Okay, I guess we're ready. Good afternoon, and thank you for joining me this Friday afternoon. We felt it was important to recap the situation and give an update about what's happening here in PI and the plan for schools in Eastern PI as well as Westwood Primary next week, and really to also discuss what we can do in terms of getting this current wave of COVID-19 under control in PEI, especially in light of the upcoming holiday season. There are 7 new cases of COVID-19 to report in the province, bringing our total active cases to 31. 2 of the cases are under age 12, and 3 are in their 20s, 1 in their 30s, and 1 in their 40s. 2 cases are close contacts of previously announced cases, and the remaining 5 are related to travel. Earlier this week, we announced 2 cases associated with Westwood Primary School. Testing has confirmed that there has been in-school transmission, and this situation is now considered an outbreak. In the few weeks, we have had sustained COVID-19 activity in PEI with almost 80 cases in just over 3 weeks. During the last 3 weeks, we've had now 2 school-related outbreaks, 5 workplace outbreaks, cases in 2 early learning child care centers. Numerous sports teams have been identified as close or casual contacts. Currently, there are 115 close contacts being followed, including over 65 children. And there are many more casual contacts related to the current active cases. In the last 3 days, over 7,600 individuals have been tested for COVID-19 in PEI, including over 3,500 PCR tests. 1/3 of these tests were among youth under the age of 19. We are able to link some of these cases to travel, and others appear to be more in line with community transmission. At this point, while our public health resources are stretched, we are still able to do contact tracing and follow up with cases and their close contacts. I think this situation is still, we would consider it serious, and while we get this current wave under control, it does require focused attention and intentional behaviors. We are very concerned about the possibility of increased transmission over the holiday season. We do not want to see people in hospital, and we do not want to have large number of families in isolation at Christmas time. The choices we make today and in the days leading up to Christmas will have an impact on us as individuals, families, and the entire province. This time last year, we were in a circuit breaker related to an outbreak. We had approximately 1,000 people vaccinated. As I said earlier this week, I do not want to have us go back into circuit breaker measures or to impose significant restrictions on our ability to gather or travel. We do not want to go back to the restrictions that were in place last year. But we've had a number of questions from individuals and groups about what they can do to help stop the transmission of COVID-19 in our province. There are steps we can take to further protect ourselves and others, and I'd like to emphasize 3. The first one's related to travel. Many of our cases are related to travel, both island residents who travel off PEI and others who travel here from other provinces. We've had cases related to travel from other Canadian provinces, including New Brunswick and Nova Scotia, as well as international travel. Some of our current cases are related to the events at St. FX University last weekend. Yesterday, New Brunswick reported the highest number of daily cases since the pandemic began, with 174 reported new cases. If you choose to travel off-island or choose to have people from away come and visit over the holidays, it is important to understand you may be increasing the risk to yourself, your family, and others. People, including children who are not fully vaccinated, should be careful if they're traveling off-island and should not travel. Anyone traveling to PEI, including PEI residents who are returning home, should be tested at the point of entry and again on day 4 after arrival. And if symptoms of COVID-19 develop, they should isolate and be tested regardless of previous negative test results. I urge island residents to limit travel, but appreciate it is really important to see family and friends. Anyone who does travel should assess their own risk and that of others and be sure to follow public health measures, including testing. Secondly, gatherings. We have discussed the possibility of limiting the size of personal gatherings. However, we recognize that many families have already made plans for holiday gatherings. Keeping your personal gatherings and holiday parties as small as possible, and keep in mind that COVID-19 is circulating in our province. Keeping your list of contacts small is important, and just because you may have an opportunity to mix with a number of different groups over the holidays does not necessarily mean that you should. We have discussed the need for each of us to do our own personal risk assessment when deciding to attend events outside our household, considering our own vaccine status and that of others, considering our own health status and that of others, and the type of activity. For example, outdoor activities being safer than indoor events. I do urge islanders to think twice about attending large personal gatherings where you do not know the vaccine status of others and or are uncertain of the public health measures that will be in place. And third, be vaccinated or get vaccinated. Recently, more of our cases have been in children because they are not yet fully vaccinated. And I've received emails and questions about breakthrough cases. And really, I believe our focus should be on how well our vaccines are working instead, especially with the Delta variant being the dominant strain. And thank you to 133,000 islanders over the age of 12 who have had 2 doses of vaccine and are considered fully vaccinated. And based on our own data, 0.07% of cases of those who are vaccinated are breakthrough cases. So despite more cases, there is less serious illness, including hospitalizations, thanks to our high rate of full vaccination. If island residents had not responded so well to the opportunity to be vaccinated, especially in light of the Delta variant this fall, we would be in dire straits now, as we would have much more transmission and serious illness. So while not 100% effective, the COVID-19 vaccine does reduce transmission and reduce the risk of serious outcomes from the virus. And being vaccinated still is our best protection overall against COVID-19 and its variants. Islanders age 5 and over are eligible to be vaccinated, and if you've not had your first dose, please make an appointment for it today. And if you've had 1 dose, you're often automatically have an appointment for your 2nd dose made. Please, you can book online or call the vaccine booking line. For parents who want an early vaccine appointment for their children, there are openings at the clinic, even in Surrey, on Monday. I know many families and students are anxious to hear about the reopening of schools next week. The last case associated with École La Belle Cloche cluster was on Tuesday, December 7th. Our recommendation is this school can reopen on Monday, December 13th. Some students will be on a daily home testing protocol. Students, staff, and volunteers at École La Belle Cloche should arrange to have a PCR test if they develop any symptoms and isolate until the results come back. And like everyone else, they should not attend school if they're not feeling well. The pop-up testing clinic will be available at the Surrey Hospital on Sunday, December 12th between 1:30 and 3 o'clock. It is also our advice that other schools in Eastern Kings that were closed to allow students time to be tested can reopen on Monday, December 13th. Our final recommendation to the Public Schools Branch is that Westwood Primary School can reopen on Monday, December 13th, except for 2 classes, with students and staff in these affected classes being required to self-isolate, given that they are close contacts. Families with children in these classes and impacted staff will be contacted by public health with testing and isolation instructions. Although there is an outbreak at this school, we are comfortable for other students and staff members, those who are not close contacts, to return to school, given we know the source of this outbreak and have been able to link these school-based cases to travel outside of PEI. Families with children on certain buses that travel to Westwood Primary will be contacted by public health regarding the need to have daily rapid antigen tests. Some families with children who attend the Country Kids program will also be contacted regarding the daily antigen testing. A heartfelt thank you to the many students, staff, and families who have been impacted by these school outbreaks. It is never easy to learn that you or your child may have been exposed to COVID-19 and have to isolate for a period of time. And I think it's especially difficult to receive this news so close to the holidays. Thank you to everyone who went to be tested, despite the long lineups, and for agreeing to isolate. Thank you to the many businesses and organizations who have also been impacted with staff members being required to isolate. And thank you to the many employers for being understanding and supportive of your employees and their families. And I really like to give a special thank you as well to everyone who works at the testing clinics and to the staff in the provincial laboratory. We know the last few days have not been easy for you, and you've worked tirelessly to test as many people as possible, as quickly as possible. And the testing that has been completed in the last week has helped us manage this part of the pandemic, is helping us manage these outbreaks, and helping to identify positive cases and to contain transmission. Thank you to public health nursing who have worked long hours to conduct contact tracing and follow up with cases. And again, thank you to everyone who has waited in line to be tested over the last few days. And to all of the health PI staff involved, and to the public too, please know the work you are doing is making a difference. Our level of testing, our contact tracing, and high rate of vaccination are key reasons why PEI continues to fare well in terms of the rate of COVID-19 per capita when compared to other jurisdictions. On behalf of many Islanders, thank you so much. Of course, these are not messages we want to be sharing really with Islanders today or any day. One of the team said to me today, we feel like there's no time to catch our breath in the last number of weeks. So as we continue to struggle to get our COVID-19 situation under control, it is important to be mindful that COVID-19 is circulating in our province and to take appropriate precautions. We know that basic public health measures, including vaccination, are effective and provide important layers of protection against COVID-19. Let us also act together now and be cautious around travel and gatherings over the holiday season. As we continue our journey with COVID-19, we will get through this together. I know we will get through it. And now more than ever, let us continue to be patient and continue to be kind. Thank you. So thank you very much, and I'll open it up to Dave Stewart from The Guardian in the room.
Thank you, as always, Dr. Morrison, for taking our questions. I guess the first one would be, considering the 2 school outbreaks recently, have there been any discussions with the public schools branch to close schools ahead of time? I guess we're a week away from the traditional Christmas break, so was there any thought given to giving the children an extended break and just sort of keeping people apart?
So, Dave, I think this, yes, there's been conversation certainly with our team in terms of what potential next steps would be. I think really today is a bit of a reminder, a warning almost of what we're facing and what we've been dealing with. And things that we have talked about are restricting more activities for those less than 12, including earlier school closures. But based on the information we have now, we also know it's important to balance that minimal disruption to families and to students themselves, and looking at the risk and trying to protect health at the same time. So we've tried to always manage that, and but those are things that we've looked at, and of course the other thing we've also talked about is around gathering limits, and so that has also been part of the discussion, but we've talked about some of those here and some of the cautions around it, and I don't think this will be anyone who's been following what's been happening over the last 2 or 3 weeks, probably most of what I'm saying here is not going to be a surprise, but I think we need to say it and talk about it and remind us all as we're going into this holiday season.
Thank you. And I guess as a follow-up question, with the numbers where they are and where we are in the year, so close to the Christmas season, you spoke about, hoping not to bring in more restrictions. Are you sort of trying to avoid that step because we're in the Christmas season? Are you still discussing, but possibly over the next couple of weeks, if the numbers stay where they are, New Brunswick hitting a record number, and we're seeing 32 active cases of PEI now, is there a chance before Christmas that things could change?
I think there's, as we've found out over the last year and a half to 2 years, there's a chance, always a chance. But I think one of the things that, and we talked about it even earlier this week, it's really, really important that people get tested when they're supposed to, when they come back from travel. Or if people are coming here and they're staying for, more than a couple days, they get tested. And even if they get tested once and they get symptoms the next day, you need to go back and get tested, and because testing will help us contain that sort of exposure and the potential impact on others. So we're through a lot of hard work by so many people. We have testing that is really remarkable at our points of entry in relation to other provinces. So I think that testing part's important. And of course, we mentioned some outbreaks in different places. It's really important, and we said it earlier in the week, not to go to work if you're not feeling well. And I think it's hard, and sometimes people don't feel that unwell. They have mild symptoms, and so I think it's just a reminder that we should do that. So it's not that we're trying not to do something or do something. We're looking at the evidence we have in our cases, looking what measures are already in place, and really hoping that people can follow these recommendations and these public health measures as best they can to minimize the transmission and to protect others, but at the same time recognizing that we don't want to disrupt our lives in the same way they were a year ago.
If I could just get one more in. New Year's Eve, there are planned large gatherings. I know the Delta is having a concert on New Year's Eve. Where are we with recommendations on that?
Well, the organized gatherings all do have to follow certain, there would be a Vax Pass event, or and masking would be important, and I think they do have to have some of those measures in place. But I also think it's important that individuals who choose to attend those events and maybe not, if they're not having their mask on and eating and drinking, they put themselves at risk, but also people may need to think about that when they're going, and do that individual risk assessment when they go to those environments.
Okay.
Thanks. Steve Bruce from CBC.
Thanks so much. Just to pick up on Dave's question about Christmas restrictions. So you mentioned that you debated them, but you're worried people already have holiday gatherings planned. So if we weren't heading into Christmas, would we be seeing restrictions if faced with the same sort of numbers?
I think it's a very fair question, Steve, but I think sort of the same answer I gave to Dave is regardless of when we were going into, really, we don't want to keep children out of school if we don't have to. We've said right along, we recognize being in school is important. So I think regardless of when we are, we would be looking at minimizing societal disruption and trying to protect Islanders. And that's been our goal all the way along through this pandemic, trying to keep Islanders as safe as possible. And I think for parents of children who are less than 12, who have school-aged children, this is, I know a lot of them, we have over 21% of our 5 to 11-year-olds are now have their first dose of vaccine. And I'm sure this kind of activity in schools would even encourage parents more to want to protect their children and minimize some of the impacts there.
I know you've said before that it's because of our high vaccination rate that we can avoid a lot of restrictions right now, but a lot of the cases that you are seeing are in those under 12 who aren't fully vaccinated yet. So I guess what would you say to parents maybe who are worried to hear that you're not imposing more restrictions as we try and keep those cases down in that under 12 group?
Yeah. I mean, I have 2 children myself in that, 2 of my 4 children are in that underage 12 group. And so I can understand the impacts of putting more restrictions in place. These are not measures that are put in place that only impact some people. They impact everyone. Everyone in this room, everyone across the province. And I think we are, I think like any parent, we want to see our children participate in activities, and we want them to do it as safely as possible. But I think just like we mentioned here, maybe my children who are not vaccinated, I may not be sending to as many birthday parties, as many, and I have to think about how big contact, because if you get exposed, what does that mean for you and your family who have to isolate? What does that mean if you have COVID and you could look back and you're going to think, how many other families will I impact if we have COVID and have to tell everybody? So I think those are the considerations that each family, each individual has to make. But I think we know most of our cases are travel related still. And so really trying to emphasize that importance of testing. And if anything changes, if something changes before Sunday and all of a sudden we need to change, we will. And we've always done that, and we'll continue to do it.
The fact that you are reopening École Belle-Cloche and those other schools in Eastern PEI, does that say that you feel as though that cluster of cases, the situation in Eastern PEI, is under control?
Well, I think the amount of testing that has happened up there and the response of the community has certainly helped us be able to feel more comfortable where we didn't see cases in other schools come up, and there was a large amount of testing done. I know there's still more testing today, and we won't have all those results done. So, as you said, if we need to, we'll make adjustments. But I think if everything goes well and nothing, that we don't start seeing a lot of other cases in other schools today, then that's certainly the plan to go ahead. And that testing has reassured us. And I think it's a bit of a taste of what we're seeing across the country. I mean, the cases and the rates of COVID in those less than 12 is the highest in that age group across the country. So we're certainly seeing a little bit of that here, and I think we'll just continue to be really careful. And today really is a reminder. Let us all think about some of that as we go into the next few weeks. And we anticipate there will be more travel and some consideration around it, and the importance of testing if you do.
And just finally, if you can just can you compare the outbreak at École Belle-Cloche and what you're calling an outbreak now at Westwood, and I guess what led to a week-long closure at École Belle-Cloche and just the impact for the two classes?
Well, I think at École Belle-Cloche, one of the concerns there was that we didn't have a source and didn't understand where the source was. So we didn't know how far, and it was multiple grades. There were not the connections between the students that we can establish in this most recent outbreak at Westwood. So that's part of it. Yeah, you're welcome. I believe there's maybe somebody on the line.
Gabrielle Drummond, Radio Canada. Bonjour, Dr. Morrison. J'aimerais que vous me parliez, s'il vous plaît, sur la situation dans l'école La Belle-Cloche en français, s'il vous plaît. C'est quoi la situation maintenant? Est-ce que c'est maîtrisé? Et à quoi ça va se ressembler la semaine prochaine pour cette école?
OK, bonjour, Gabrielle. Alors, on vient d'annoncer que École Belle-Cloche, on veut que ça ouvre pour les étudiants, commençons lundi. Et puis, parce qu'on n'a pas trouvé d'autres cas depuis le 7 décembre associés avec École Belle-Cloche. Il va y avoir les étudiants qui vont continuer de faire tester ce week-end et aussi de faire les tests chez eux. Mais à part de ça, on veut qu'ils retournent à l'école.
Est-ce que vous avez trouvé la source de l'infection, de la contamination à l'école La Belle-Cloche? Et pourquoi vous vous sentez en mesure assez confiante maintenant pour rouvrir l'école lundi?
Alors, on a fait tellement de tests depuis vraiment les 3 derniers jours, vraiment la semaine. Alors, on a plus de confiance qu'on peut avoir. Il n'y a pas beaucoup de transmission qui en fait encore. Mais on ne savait pas, on n'a pas trouvé une source pour l'outbreak à École Belle-Cloche. Mais on fait beaucoup de tests et on sait que le niveau de vaccination dans la communauté aide vraiment à contrôler les outbreaks. Alors, on sait que ça nous aide pas seulement dans cette occasion, mais partout à l'île. Si on n'avait pas le même niveau de vaccination, on aurait eu bien plus de cas ici à l'île.
Et le nombre de cas augmente ici dans la province, mais vous hésitez toujours de mettre en place de nouvelles mesures sanitaires pour les festivités de fin d'année. Alors, Dr. Morrison, qu'est-ce que vous attendez précisément pour effectivement mettre en place de nouvelles mesures et restreindre les consignes des festivités de fin d'année?
Et Gabriel, j'espère que je comprends la question, mais on veut juste vraiment que les insulaires se souviennent des mesures de santé publique, les consignes vraiment de faire tester si vous voyagez, de peut-être penser si vous devrez voyager ou non, si vous voyagez, de tester et de suivre et de penser si vous avez vraiment besoin d'aller tous les activités sociaux. Mais on sait que la famille et les amis sont tellement importants ce temps ici. Alors, j'espère de ne pas mettre les nouvelles mesures de santé, les nouvelles restrictions, mais on va voir ce qui arrive vraiment dans les prochains jours. On vient de dire qu'il y avait, je pense, plus de 80 cas depuis les 3 semaines. Et puis, c'est beaucoup de personnes pour nous ici à l'île du Prince-Édouard. Alors, on a l'activité de COVID et on va continuer d'essayer d'impressionner aux insulaires de suivre les mesures qu'on peut, parce qu'on ne veut pas que plus de gens soient malades ou sont en isolement pendant les vacances.
Et ma toute dernière question, c'est que vous ne recommandez pas aux gens de voyager pendant le temps de fête à cause de la quantité, du nombre de cas de COVID. Mais est-ce que les gens qui ont eu leur 3e dose, est-ce que pour ces gens-là seraient plus en sécurité pour faire des voyages? Est-ce que ces gens pourraient faire des voyages parce qu'ils ont eu quand même une 3e dose?
Oui, et c'est vraiment que on dit si vous n'êtes pas vacciné, faut vraiment on fait pas une recommandation de voyager. Et c'est sûr, mais si vous êtes vacciné et vous choisissez de faire les voyages, il faut faire attention et quand vous venez de retourner ici à l'île du Prince-Édouard de faire tester et pas seulement une fois, même si c'est négatif, il faut avoir un autre test ensuite. Pour les personnes avec les 3e doses, on sait qu'on a seulement 8 000 personnes qui ont eu la 3e dose. Alors, on n'a pas tellement de gens encore. J'espère que ça va augmenter dans les prochaines semaines et quelques mois. Ils sont plus protégés de maladies qui vont pas être aussi malades pour rentrer à l'hôpital, mais ils peuvent quand même peut-être recevoir COVID. Mais alors, on change pas ce qu'on dit si vous avez 2 ou 3 doses à ce moment. Mais ça va peut-être changer par le printemps.
Merci.
Okay.
Bonne journée.
Bonne journée, Gabrielle.
Louise Martin, TBC.
Hi, good afternoon, Dr. Morrison. I was wondering how many cases are connected to the St. FX outbreak.
Hi, Louise. I believe we have, I believe it's 4 cases. I don't have that right in front of me, but I believe it's 4.
And how many exact cases connected to Westwood now?
There are 3 students.
Okay, 3 students. I know if we've been through outbreaks before, this one just seems different given the community spread. Can you somehow tell us on a level of, your concern radar where you're at with this particular outbreak?
Well, Louise, I think it's more than one outbreak. I think we're concerned because we have had these elevated numbers of cases, sustained number of increase of cases over the last 3 weeks. So it's not just one outbreak, it's that we have more than one outbreak. We talked about the fact that we have, 2 different schools impacted. We have 5 workplaces impacted in the last 3 weeks. We've had cases in early learning centers. So it's all those things together over the last 3 weeks that have increased our level of concern. But it's also seeing what's happening across the country, which we've talked about. We always have talk about because we are influenced and we are impacted of what happens in other provinces, and the rates of cases going up, particularly being driven in the country by the rates in Ontario and Quebec. But we know New Brunswick had its record day yesterday. So it's a general level, Louise, of increased concern about the amount, the number of cases, but also knowing that our public health capacity is certainly being stretched. And but appreciating that our vaccination rate is, I'm so thankful, and someone else said this to me as well, we're so thankful for our high vaccination rate because especially with the Delta, knowing it's been so transmissible in this fourth wave, which has continued longer across the country than I think was initially anticipated, that if we hadn't had that, we would be in a much worse situation here. So I am thankful to that, and that may be helping us at least curb some of the extent of the outbreaks that we're seeing.
I mentioned to Steve that if something changes by Sunday, as you've always done, you would make changes. So what would need to change to put in stricter measures? Was there any consideration, for instance, being given to putting a pause on recreational sports, especially since some of those athletes are not vaccinated?
So, Louise, and I think I know there's been issues with the phone line, so you may not have heard my response to Dave, but I think exactly you mentioned one of the measures that is under consideration, that if we need to, it would be a pause on recreational sports and other activities for those under 12. It would be a potential change in gathering limits. It could be earlier closure of schools, but we are every day, every time we get a phone call from the lab and then talk to cases, we look at the evidence we have and make adjustments, and it wouldn't have to be on Sunday. It could be at any point in time. If we need to adjust, we will. And sort of reiterating the fact that we'll try to balance that, minimizing the activities we do and the societal disruption that we have when we put measures in place, but recognizing we have had at the forefront protecting our health system capacity, wanting to make sure that we have good healthcare capacity there whenever we need it, and trying to protect islanders from getting sick. So we will continue to do that every day, but it's exhausting and tiring for everyone involved, including the public, and that's why I think I have to emphasize, maybe to myself as well as everyone else, we're going to get through this, and we're going to do it one day at a time based on the information we have.
Absolutely, and I'm sorry if I missed that, Dave's in your answer to Dave's question earlier. With you mentioned cases in other parts of the country, particularly like Ontario, Quebec, over 2,000 cases today. People are, as you mentioned, going to be considering traveling at Christmas within Canada to see family and friends. And some are worried about leaving Prince Edward Island for the holidays and then finding out new restrictions are in place when they come back, or there are border restrictions. What are the chances of that happening, where you might impose self-isolation again, or any border restrictions over the holidays? Any idea?
I mean, I think at this point in time, we have certainly not don't have any intentions of going back into the same kinds of restrictions as we did this time last year in terms of any of our border measures. I do think it will continue to be very important, and to make sure you're tested when you do return, but also to do follow-up testing. And I know it's a requirement under the legal order for those who are traveling internationally, and it's certainly a strong recommendation for those who are traveling even domestically. And so I don't anticipate additional measures, but reinforcing how important that testing is, and not continuing to go back to school or work if you've come back from travel and have any symptoms.
All right. Thank you very much, Dr. Morrison. I appreciate it. Have a good weekend.
Thanks. You too, Louise. And I think that's it. So thank you very much.